Hi folks, my name is Fogel. I'm the author of A Matter of Life and Breath and a pulmonary fibrosis patient for the last 5 years. Recently I began a course of laser therapy treatment using class 4 medical grade lasers, and I promised back then that when I started that I would give an update on my progress after receiving laser therapy for pulmonary fibrosis. A few days ago I had my pulmonology appointment at the new Lexington Medical Center pulmonary testing lab in South Carolina. I went through the full battery of all pulmonary function tests. Well, the great news is my forced vital capacity was significantly increased from 53% of expected to 74%. Significant. But the most amazing measure was that my DLCO, which we call the DILCO, has gone from 31% to 51%. For those of you who have lung disease or have undergone pulmonary function testing, you probably already know that the DILCO is the gold standard measure for whether your lung illness is deteriorating or is it stable, or if the disease is progressing. That will result in declining lung function. I talked to many other patients in the support groups which I facilitate who started out with a DILCO in the 65 to 70% range, and it is reducing or declining by about 5 to 10% per year. What was 70% a few years ago is now 45%. That is fairly common among pulmonary fibrosis and other interstitial lung diseases. For those of you who already know my story that I wrote about in my book, or you've read this book, you know that the beginning of this journey for me was a very dark place. After being provided an oxygen tank and told that without a lung transplant, the severity of my lung disease would likely cause my death in 3 to 5 years. With that sad news, I continued to decline to the point I could barely walk 50 feet, even on oxygen. That was really resulting from my beginning to become inactive. After a mentally and spiritually reflective time and turning point, I made the decision I was going to battle this decline and live my life fully again. But I still have to use oxygen when I exercise. You may notice these lines on my face are from wearing an oxygen cannula. I still use oxygen when I go for walks and hikes and when I work out in the gym. I didn't write the book to make money. I just wrote it to tell the story of how a disciplined and consistent approach of exercise, quality nutrition, breathing exercises, quality sleep, and meditation all worked together to restore my health. In the appendix of the book, I listed about 60 different things that I've tried, and I gave ratings of the most effective. Since publishing the book in 2023, that list continues to evolve, and one such item is laser therapy. This is done by a medical professional using an FDA-approved Class 4 medical grade laser that can penetrate into the lung tissue and promote blood circulation while reducing inflammation. The FDA-approved laser devices are for soft tissue and connective tissue injuries, and these devices have been used extensively across the U.S. and other countries for many years. The use of laser therapy for pulmonary fibrosis is an off-label use which has been recently experimented with, showing excellent results. I am one of those experiments. So I decided that I wanted to try it out, since there are no side effects and the costs are very reasonable for the laser therapy. I began a program of 15 laser therapy sessions which last about 30 minutes each over a 5-week period, 3 times per week. A Class 4 laser is only available for a medical professional practitioner to purchase, and they cost a few $1,000s for the minimum entry-level version. Lastly, I don't want to set anyone's expectations that a few laser treatments are some magic cure. Okay? The 4 to 5 miles of walking I do every single day, my other exercise for strength building, and my nutrition. It's a whole lifestyle of health, as I've described in my book as well as on the video I mentioned. After reviewing my lung function test and discussing my approach to health, my new pulmonologist asked me if I wanted to consider any pharmaceutical interventions. And I said flatly no. I don't take any drugs, haven't for years. To paraphrase him, he responded with, I can't really blame you. The available medications don't work for everyone and they have many side effects. So just keep doing what you're doing. It seems to be working well for you. We'll see you in May 2025. I hope that this information has been helpful. Remember, I'm not a physician, I'm not a doctor, I'm not a medical professional. These are things that have worked for me, things that you may want to explore and talk about with your own pulmonologist or your own physician. And happy breathing to you all.